I went to medical school in San Francisco, University of California at San Francisco, uh, and finished my MD degree there, and then subsequently returned to the University of North Carolina at Chapel Hill to do my obstetrics and gynecology residency. I have been performing GYN surgery since 1997, but as of a year and a half ago, dedicated myself exclusively to working with Dr. Berger and doing tubal reversal surgery.
And before you started working with Dr. Berger, did women frequently ask for tubal reversal procedures? Was that something that came up in your practice prior?
As a generalist, I did not see a lot of women that requested tubal reversal surgery. However, our practice was majority of young pregnant women, so I didn't get a fair assessment of how many women were out there that wanted to have tubal ligations reversed. However, I did have a partner that exclusively performed GYN services, and she fairly often had requests or inquiries about tubal reversal surgery. I think I had practiced high-risk obstetrics and gynecology for a good 7 years after I finished my residency, and just one day I had just realized that I needed to change what I was doing, or I wasn't going to last very long doing it. The way medicine has become, it's become very high volume, very stressful, little time with patients. I felt like I really wasn't helping people to the best of my ability. Patients would come, they would go, they would lose their insurance, have to go find another provider. People would come with job movement at the end of pregnancy or leave in the middle of pregnancy, and I just found that I didn't get a lot of personal fulfillment out of it. I especially like my role as a tubal reversal provider because I feel like I'm being what a physician is supposed to be, using my skills to help people to the best of my ability. And I especially feel that since it's not a widely offered service, that I'm doing even better for a lot of women. On average, about 8 to 12 a week currently. It seems like the most common reason is basically none of us can predict the future. And most commonly, it seems women find themselves in new relationships, usually bad marriages, separations, divorce, and they find themselves with a new partner, and just very strongly they would like to have children together. A close second to that would be people that just change their mind and decide they want to have more children. And then a lot of women have experienced changes in their bodily functions after tubal ligation.
Are you referring to post-tubal ligation syndrome?
Yes, what most patients refer as post-tubal ligation syndrome.
And how frequently do you hear that as a condition that women feel that they've developed?
We hear it very commonly. There are probably a lot of women that come through here that never voice it or share it. But at least in my experience here, I see a patient at least once a day, if not every other day, that has experienced worsened menstrual symptoms or bodily functions after a tubal ligation procedure.
And how much follow-up? Are you able to follow up with them after surgery to see if that's improved?
I am in the process of doing that now. Last year, we did a small case study on 5 women that had tubal ligations and experienced post-tubal ligation syndrome. This summer, it'll be a full year. And thus far in talking with them, it seems at least about 70% of them have gotten better. Very frequently, I'm amazed that women post on the message board how much improvement they feel after they have reversal surgery. Most patients come from long distances, so there's not a lot of direct contact. But the most amazing thing is our tubal reversal patients seem to keep close contact by email and through electronic means. So we hear from a large number of our patients. The best part is really just using my skills to help a woman, a couple, or a family achieve what they otherwise would not have been able to achieve, and that is to add more children to their family or their relationship, or improve their perceptions about their body. The thing I like the most about this center, and I come from my experience of working in a large university and also working in a large, good quality hospital in Raleigh, is that this center works with amazing efficiency. We take great care of patients. The staff seems to be real happy and motivated, and we're all dedicated to just doing one thing, and that's tubal surgery. And it feels good to be a part of a place that works with such high efficiency for the betterment of patients. They're about the same as some of the best hospitals I've worked at, and probably even better, mainly because we're all focused on one thing. The staff really knows their jobs, and we're all dedicated to making that one goal happen, and that's safe outpatient tubal reparative surgery.